Hey, welcome back to my how-to vlog series. This time I want to talk about how to understand addictive disorders. This is really becoming a big problem for a lot of people who are taking prescription medication for chronic pain. So that's what I want to focus mostly on, is around the medication issues and how people can get in trouble. I do want to say though that some people who are being, quote, labeled as addicts are no such thing. So let's talk about that a little bit. That's what I want to really get into. So let's start with the question, what is addiction? What is a medication use disorder? That's what we want to do, is get that really clear. Well, first of all, I believe it's a neurobiologic brain disease that impacts people biologically, psychologically, socially, and spiritually. You're going to see a definition of addiction in a little while that was developed by the American Society of Addiction Medicine. But let's talk about the stages of a medication addictive disorder. I don't know anybody that has a goal to become addicted to alcohol or other drugs, including pain medication. It just doesn't happen. It's a process for people. Now let's talk about the initial exposure, the initial experience to the medication. For me, I'll share with you that my first time was age 12 when I was injured playing sandlot football. I was rushed to the emergency room, given a shot of a painkiller. I don't know what it was, but I do know what they sent me home with. They sent me home with Tylenol codeine. Now, because of my genetic history with alcoholism in the family and a lot of trauma and drama in my family, I was at higher risk from the first experience. So most normal people, when they take that medication, they don't like how it makes them feel. They want to get off it as soon as they can. And for me, though, from the first dose, it was like, wow, this is really cool. And that's what happens for a lot of people. Let's say someone is living in a very challenging environment, like suffering with chronic pain. And all of a sudden, they're giving something that takes the pain away. Now, if they have a genetic history, a family history, or a problematic living situation with ongoing exposure, they might be at high risk. Most people, probably 80 or 85% of the people taking pain medication, won't have a problem. It's that 10 to 15% of the people that will. So with ongoing exposure, the problematic people, usually with an addictive brain response or a reward deficiency syndrome, as Dr. Kenneth Bloom calls it, will move into a different realm, which I call seeking and reaching, or doctor shopping. I know that was true for me, the doctor shopping. And I could convince the doctors to give me pain meds because I had first convinced myself I wanted them, I needed them, I had to have them, or else. And it was really easy to convince the medical profession to ease my pain. Now, the other thing that happens with ongoing exposure is people start building tolerance. Now, that's normal and natural. We usually expect that, and there's different ways to address that. But somebody with high risk factors usually builds an abnormal tolerance. They really start needing more and more to get the same effect. And then they can enter the danger zone, medication abuse or pseudo addiction. We're going to talk more about that in a little bit, so I'm not going to say much more about pseudo addiction, except it looks a lot like addiction. Now, if people don't get help at that point, they can move into full-blown addiction, and people die from this disease. I want to talk about some misunderstood terms. There's a lot of confusion about these. Tolerance, physical dependence, addiction, and pseudo-addiction. Now, these started out a long time ago in 2004, and it was at a conference, and I got the white paper from this, and I took out some of these definitions, and then a later definition by the American Society of Addiction Medicine on addiction. Let's start with tolerance. The adaptation response to medication. Well, I like to put things down into earth language. So in earth language, I tell people, early on, maybe 1 or 2 pills would help you, and now it takes a whole bunch, 4 or 5. So your body has gotten used to the drug. The brain starts adapting. The brain will start producing more receptor sites, for example. It will change how it makes neurotransmitter chemicals, and all that to try to achieve homeostasis. There's a big misunderstanding between physical dependence and addiction. Physical dependence is a state of adaptation that when people stop, they get in bad trouble. So in earth language, it's like when your body gets used to taking the meds on a regular basis, you start adapting to that as being the normal state, and then when you stop taking it, you can have withdrawal. You can get very sick. Now, a parallel example would be somebody with diabetes who's taking insulin to manage it. If they just stop that insulin, they will have problems. They will get sick. So their body is dependent upon it. And there's one chemical all of us are dependent on, and that's called oxygen. We need it, because without it, we die. Well, physical dependence to opiates is very common. It doesn't mean it's addiction. The body just adapts. So let's talk about addiction. This is the current definition of addiction by the American Society of Addiction Medicine. They say it's a primary chronic neurobiologic brain disease that impacts people in several different ways, and there's genetic factors involved, psychosocial factors, and spiritual factors, as well as environmental factors. That, a better way to say it would be when you're taking your meds for reasons other than physical pain relief and won't or can't stop taking it, even when you have bad problems, hey, you're addicted. This can mess you up. It can hurt you. It can ruin your life. So a lot of people with addiction continue to use the substance, whether it be pain meds, alcohol, or other drugs, or start mixing medications with alcohol and other drugs, and they won't stop or can't stop in spite of their life falling apart around. So how about pseudo-addiction? Well, this was the definition that committee came up with for pseudo-addiction. A lot simpler. It looks like addiction. People may appear to be med-seeking, drug-seeking. They may run out early of their meds. But the behaviors are caused by mistreatment or undertreatment. And if it's pseudo-addiction and the person starts getting their pain management needs met more adequately, all those, quote, addiction, unquote, symptoms go away. And sometimes it's really hard to differentiate. And you know what? I give people a benefit of the doubt. If they are really convinced they're not addicted, I say, well, it might be pseudo-addiction. That's the good news. The bad news is my treatment plan's 100% identical, because if people stay at pseudo-addiction long enough, they will. And speaking of the dark side, once people do have a substance use disorder and they want to get into recovery, there's always a risk of relapse. Now, for me, recovery from medication dependence, substance use disorder, addiction, whatever you want to call it, people need to meet certain criteria. They have to have an accurate understanding about pain and their addictive disorder. They have to say, yes, that's me. They have to get over the overwhelming shame, guilt, and remorse of having this personal disease. They also need to have hope and belief that not only is recovery possible, but it's preferable, and they need to be doing footwork in 4 areas: their physical self, their psychological self, their social interactions with friends, family, community, and their spiritual self. And then they need to adhere to a recovery-friendly medication management plan for 90 to 120 days. Then they moved into recovery. At this point, they can relapse because, like many diseases, there's a tendency towards remission and relapse. According to the American Society of Addiction Medicine, there are cycles of relapse and remission. But what they also stated, and it was published as long ago as 2000, that hypertension, asthma, and diabetes have as high or higher cycle of relapse rates as addiction does. And yet they don't get treated the same. A lot of people who relapse get punished for them instead of treated. On this slide, you can see graphically some of the differences. The drug dependence or addiction, there's a 40 to 60% relapse chance. For type 1 diabetes, 30 to 50%. For hypertension, 50 to 70%, and for asthma, 50 to 70%. So they're similar, for drug dependence to other chronic illnesses. And we've got to start treating this as a disease, and not just with lip service, but with the way we interact with it, especially when it comes to relapse. One of the things I help people do is look for red flags that's indicators that they're going the wrong way. We're going to go over some of the common ones. What I look for is the person's stress, depression, or isolation worsening, because these 3 things can really become disruptive. They can cause the person to start having some very bad problems, biologically, psychologically, socially, and spiritually. If a person has experienced cravings or preoccupation with their pain meds, they're either on the wrong type or the wrong dose. We need to intervene at this point right away. Is the person really taking the medication exactly as prescribed? And are they taking it for the reasons? Now, they might be taking it as directed, and maybe they don't need to be, or maybe they're self-medicating. Either way, taking too little, taking too much, both can be dangerous. A big one, a big red flag, is when people stop doing other things besides just taking meds, the non-medication, the non-pharmacological. Do they stop exercising regularly, eating a healthy diet, interacting with people in a healthy way? When they stop doing all those things, that's a big red flag, and at some point, like if they have a pain flare-up, they're at much higher risk of going off the deep end. Is the medication causing any negative consequences, biologically, psychologically? A person that's in recovery needs to be honest about their medications, including alcohol. Yes, alcohol too. A lot of pain patients who get in trouble with their pain meds have a mistaken belief because they never had trouble with alcohol, they can still drink. And if you become addicted to one psychoactive, mood-altering substance, you're at high risk for cross-addiction or going back to your original drug of choice. And it's best to have a policy of staying away. Now, for chronic pain management, people may need to be on appropriate, monitored, recovery-friendly medications. That's different. People should never use more than one prescriber for their pain meds. That's not safe, and it's against the law. So we need to make sure that that's happening. For people in really early recovery, it could be very dangerous to have elective medical or dental procedures. So for people in early recovery, I urge please wait until you have a solid foundation and then take precautions for pre and post surgery. When I find someone who is resistant to the recovery-friendly non-narcotic, narcotics a legal term, what I really mean is non-opiate, non-benzodiazepine medications, or referrals to non-medication type pain management like hydrotherapy, physical therapy, chiropractic, acupuncture, etc. That's a big red flag that there might be a big problem, and that could lead to other red flags. Using, like I mentioned earlier, something other than your pain meds, including alcohol or other drugs, marijuana, over-the-counter analgesics, methamphetamine. A lot of people with the over-the-counters say, well, they must be safe because I can buy them without a prescription. Not necessarily, and they may have bad interactions with the medication you're on, or they may cause problems medically for you, especially if it's the acetaminophen or the Tylenol. That can cause some liver problems. Now, is pain medication causing problems in the quality of your life or relationships with your significant others? This is a big one. You know, people who run monitored medication management should not be going into withdrawals. What it usually results in is people either take too much of their medication and run out, or they're not on the right schedule. So you need to talk to your doctor if you're experiencing withdrawal-like symptoms, if you go too long between doses, or stop your medication abruptly. Now, if you're going to stop your medication, don't do it on your own. Talk to your doctor and learn how to do it in a more humane way so you don't hurt yourself. Big red flag is if there's a history or family history of alcoholism or other drug addiction. This could put people at high risk for relapse. It could put people high risk of a lot of family members or friends will often call my office and say, I'm afraid my husband, my wife, my father, my mother is addicted to their pain meds. And I try to have them take a step back, take a deep breath, and tell me about it. A lot of times what it really is people have become adapted or tolerant, and they're dependent upon their medication, but they're not addicted. So I'll ask them, what are your concerns? Now sometimes some of the concerns are big red flags, like, Dr. Grinstead, is it normal for my wife to fall asleep in the middle of dinner? Dr. Grinstead, is it normal for my husband to sleep 18 to 20 hours a day? Is it normal for temper tantrums and lashing out all the time? Is it a problem because can't think clearly or make decisions? Yeah, all those might be indications that something's wrong with the medication management plan. Does your use of medication cause you to have a problem at work or home, or with family and friends, or society in general? For me, when I have someone, I want them to sign a consent to release for any other health provider they're working with, so I can discuss their treatment planning with them. When I get some resistance to that, I'll work with it and find out what that reluctance or resistance is about, and eventually, if they will not sign a consent, I'll have to say, ethically, I cannot help you. I want to know the whole picture. Now, a big one is when people are more concerned about their medication than their pain. That's a big indicator that they're moving the wrong direction. So that's it. We've done it again. We've come to the end of another how-to vlog. And once more, I want to remind you of some online resources. my freedomfromsufferingnow.com site, which you will find a lot of good stuff, free articles. My blogs are all there, including this one. And there's also on the events page under webinars, there's a free webinar and several low-cost webinars that you can opt into. My personal Facebook page, Dr. Steve Grinstead. My YouTube channel now has over 500 videos, including several of these how-to vlogs. And I want to let people be aware of the chronicpainanonymous.org website. It's a great resource for people living with chronic pain. I hope you found this helpful, and please come back for more how-to vlogs in the future, and thank you so much for joining me today.